My name is Dr. Kurt Belk, and I'm a board-certified emergency physician and the medical director of the Urgency Room. I want to thank you for choosing us as your healthcare provider. The following video offers follow-up care instructions to your recent visit.
I'm Dr. Carolyn McLean, a board-certified emergency physician. You are diagnosed today with a sprain or strain. In your joints, there are strong bands of tissue called ligaments. These ligaments hold your bones in place, and when you sprain or strain a joint, it moves in a way that stretches, tears, or injures these bands. When that happens, it causes pain, swelling, or tenderness that can make using the joint difficult. For instance, if you sprained your ankle, it can be hard to bear weight and walk. If you've hurt your wrist, you might not be able to use your hand or arm. If you hurt your knee, it may feel loose or like it wants to give out. A sprain can put you at risk for falling and further injury. It's important to be careful. It can be difficult to determine initially the severity of a sprain because of pain and swelling at the joint. To help us understand the extent of your injury, your doctor may have ordered an X-ray, and then, based on the X-ray, examined your ability to move the joint. Treatments for sprains and strains vary. You might have an ACE wrap or a splint. You might have some kind of walking aid, such as crutches or a walker. We also sometimes prescribe a knee immobilizer to stabilize an injured knee. Once you're home, a helpful word to remember is RICE. It stands for rest, ice, compression, and elevation. We want you to rest and avoid excessive use of the injured body part. We want you to use ice to the area every 20 minutes for as many hours as you can, up to 48 hours. After that, you can apply heat to the injured area if it feels good. Keep your injury wrapped or in the splint to compress the area. And finally, keep your injury elevated as much as possible. Your injury might benefit from a different combination of treatments. Your doctor might tell you to apply heat sooner or ice longer. Your doctor may prescribe medications for pain, such as acetaminophen, ibuprofen, or a pain medication to help you heal. People often ask, how quickly can they start using their injured area again? Your body is a very good judge of what you can and can't do. If you do something and it really hurts, you shouldn't do it. The length of the healing process depends on many factors, including the severity of the injury, your health, and your age. If your skin turned black and blue around the injury, that means it was severe. People are often surprised to know that if you've injured a ligament, it can take longer to heal than a fracture. If you're older, these injuries can last longer and be more debilitating, weeks and even months after the injury. A good rule of thumb is to slowly start using your wounded body part again. If you wince from pain, slow down. If it's achy but okay, keep using it to help it regain its normal function. We hope your injury heals soon. If not, contact your doctor or come back to see us.
These videos are intended to provide helpful health information to the general public. They are not intended to be a substitute for professional medical advice. You should not use this information to diagnose or treat health problems, and you should not use these videos in place of a call or visit to a medical professional. Talk with your physician about the proper treatment for your particular condition, and always follow your physician's advice. If you think you need an ambulance or are experiencing a medical emergency, please dial 911 immediately.